Good morning, afternoon, and evening, everyone. Thank you for joining us for today's webinar titled A Closer Look on the Ground, Breastfeeding Practices, Benefits, and Challenges in Jordan. My name is Shabani Ghosh. I am the Principal Investigator for the Jordan Nutrition Innovation Lab, and I'm also a professor at the Friedman School for Nutrition Science and Policy at Tufts University. As more attendees are joining the webinar, I will begin by going over some of the logistical items. Next, please. I would like to direct all attendees to a few functions on this Zoom webinar. At the bottom of your screen, you should see a chat icon and a Q&A icon. Please do use the chat feature to engage with other attendees as well as with the hosts and the panelists. I believe Maha Sheikh is posting notices in the chat box, so do feel free to introduce yourself. Next, please. If you have a question for any of the panelists as the presentations are going on, please use the Q&A feature. We have allocated the last 20 minutes of this webinar for Q&A, at which points the panelists will respond to any questions that are remaining. The Q&A function of the webinar generally functions as either an online response or a live response. So please pay attention to that that Q&A box because panelists might respond online. Next slide, please. Before I introduce today's moderator, let me just give you a brief introduction of what the Jordan Nutrition Innovation Lab is. We are a research and capacity building program that is supported by USAID Jordan, and we pursue activities focusing on supporting health, optimal health and nutrition well-being of women and young children in Jordan. Some of our key objectives are implementing a rigorous maternal and child nutrition research agenda, including conducting analyses of existing nationally representative data sets, conducting comprehensive evaluations of programs such as USAID's Community Health and Nutrition Program, and building and implementing fellowships, scientific symposia, workshops, and webinars. I'd like to introduce our moderator for today, Dr. Muad Al-Rahamne, who is a postdoctoral research fellow with the Jordan Nutrition Innovation Lab at Tufts University. Dr. Al-Rahamne has earned a PhD in epidemiology from the University of Navarra in Spain. He has worked for NGOs leading regional and national projects and studies on emergency management, disease control, COVID-19, infectious diseases, biosafety, and biosecurity across the MENA region. Within the Jordan Nutrition Innovation Lab, Dr. Al-Rahamne's main focus is to support the research agenda, which includes both quantitative and qualitative assessments that are being currently conducted. He contributes and oversees the technical aspects of the research and program evaluation. In addition, he supports the technical aspects of our capacity building activities, including our methodology workshops, the scientific webinars, as well as the symposia. Over to you, Dr. Al-Rahamne.
Thank you so much, Dr. Shibani. So hello and welcome. Thank you for making the time to join us today as we talk about a closer look on the ground and breastfeeding practices, benefits, and challenging in Jordan. So breastfeeding is the optimal method of maternal nutrition for infants in the first year of life due to the many health benefits it offers both for infants and mothers, including improved immunity and reduced risk of breast cancer, respectively. Despite the critical importance of practice, mothers often face breastfeeding challenges related to their caregiver work status, demographic factors, psychological attributes, healthcare attributes, biomedical constraints, and policy, which can lead to increased use of formula and decreased exclusive breastfeeding. In this webinar, distinguished panelists will share insights from recent study on breastfeeding practices, challenges women in Jordan face, and the protective effects of breastfeeding on the mother's health overall, especially related to breast cancer. So without further ado, let me introduce you to our panelists for today's webinar. So we will have Dr. Aya Zaid Al-Kilani as Associate Professor of Public Health and Nutrition at the University of Petra. Also, we will have Zainab Al-Bukhari, a lactation consultant from the Institution of Family Health and Community Health and Nutrition Project. And finally, Dr. Reem Al-Ajloni, the Director of the Jordan Breast Cancer Program. So let's start with Dr. Aya. Dr. Aya Talal Zaid Al-Kilani is interpreter in education research and an academic faculty member of public health and nutrition at the University of Petra in Department of Nutrition in Faculty of Pharmacy and Medical Sciences. Dr. Aya earned her PhD from the Queen's University of Belfast in UK in 2019. Dr. Aya has received many awards, including Research Plus Empowering Women in Business and Academic distinction. She has a strong background in nutrition sciences, mother and child nutrition, gestational diabetes, type 2 diabetes, public health, and community-based research. And she has worked as a nutrition counselor for the Infant and Young Child Feeding Project for almost 2 years. At the University of Petra, Dr. Aya has an interest in sustainable strategies that help the university and the local community, including awareness of the healthy lifestyle and mind, finding the best balance between work and personal life, avoiding distractions, stopping interruptions, and prioritizing daily objectives. Accordingly, she fulfills her role as the regional and international coordinator of academic research funds, training, and collaboration at the university. Dr. Aya will talk about struggles and barriers to breastfeeding in Jordan. Welcome, Dr. Aya. We are happy to have you here. The floor is yours.
Thank you very much, Fuad. It's really nice to be with you today. So, this topic is one of the most important topics that we are facing every day with the mothers, especially like new mothers. So my topic today is struggles and barriers to breastfeeding in Jordan. Next, please. In this presentation, we're going to have a bit background. I'm gonna identify the objectives, some research studies, and research outcomes, conclusion, and recommendations. Next, please. So when it comes to breastfeeding, it is an old and new topic that we all care about due to its endless importance to the mother and the infant's overall health and benefits. We all know that good nutrition in early life is essential to lifelong health. Therefore, receiving exclusive breastfeeding, ABF, is very important to protect against diseases and prevent morbidity and mortality in infants and young children, including malnutrition and obesity. Next, please. In Jordan, the Jordanian Ministry of Health and UNICEF are supporting Save the Children of Jordan and other community-based organizations in a national breastfeeding awareness campaign in all 12 governorates. Several studies and surveys have been carried out in Jordan, but these are really few. And their results over the last 20 years have shown varying rates of breastfeeding. Demographic and health surveys conducted in 1997 and 2002 showed that exclusive breastfeeding rates among Jordanian infants less than 6 months old were 12% and 26.7% respectively. Next, please. In 2014, a study was conducted in Jordan at 6 main governmental and private hospitals in Amman, Irbid, and Zarqa to investigate the prevalence and barriers of exclusive breastfeeding among Jordanian mothers. The result of this study displayed that adherence to exclusive breastfeeding as recommended by the WHO was 1%. On the other hand, a recent study conducted in northern Jordan to determine the prevalence, predictors, and barriers to exclusive breastfeeding found that 33% of the infants received the recommended duration of exclusive breastfeeding. Next, please. When it comes to Southern Jordan, Tamimi and colleagues noted that the rates of breastfeeding was 20.9% in a cross-sectional study of 400 mothers. However, all those studies that I mentioned earlier, they do not represent all regions of Jordan, so they cannot be generalized. Next, please. So the objective behind all of this webinar or my presentation for today, we all know that maternal and infant benefits of breastfeeding are well documented. However, many parents experience obstacles to achieving their breastfeeding goals, leading to reduced rates of breastfeeding initiation and continuation. Next, please. The factors that influence an individual desire and ability to breastfeed are varied and include individual parent considerations, practitioner influences, hospital barriers, societal factors such as workplace and parental leave policies, access to lactation support, and social support of their breastfeeding goals. Next, please. So now where to go? So is it science? Is it practice? Or is it a combination of both? Next, please. So therefore, in this research study, it was conducted in 2015. It's about perceived barriers of breastfeeding among Jordanian mothers. Next, please. The study design was a cross-section descriptive design. The study population were 500 Jordanian mothers. Next, please. And the main findings, so they divided the perceived barriers into three main factors. The first one was maternal, and the items of perceived barriers was, it is a tiring process, as breastfeeding is a tiring process. It interferes with the mother's sleeping pattern, so mothers would have sleeping difficulty while breastfeeding. And the process of breastfeeding is an embarrassing process to the mothers. And also they would have some physical problems like cracked nipples. And they would also have a lack of knowledge about breastfeeding results on unsuccessful practice. They could have like a body image disturbance. And they reported that they did not have enough skills to practice breastfeeding, and breastfeeding practice is, like they would say, why to perform it while we have insufficient or no milk. Some mother would have a bad experience of breastfeeding, that a previous one that will limit her ability to do breastfeeding in her next baby. Next, please. Other factors regarding the infant. So the mother is always worrying if that her infant wouldn't have enough milk or enough nutrition, and the latching on properly make breastfeeding more, an inability to breastfeed properly if the latching process is not well stands. An infant's difficult temperament makes the breastfeeding harder. If the infant has problems physical problems, that will lead to a very hard practice of breastfeeding. Also, infants refusing of breast milk also interferes with the breastfeeding. Feelings anxious of no enough milk obstruct breastfeeding practices. Next, please. And when it comes to socio-environment factors or perceived barriers, many women reported that breastfeeding in public places is an uncomfortable process. It limits social activities with others, and like almost the majority of the women emphasizes on the lack of husband encouragement that makes the breastfeeding practice more difficult. Returning to work affects also breastfeeding adversely. Long working hours result on diminished milk production. Lack of nurse or midwife encouragement to practice breastfeeding, also one of the perceived barriers for the mothers. Next, please. When it comes to the second research study, it was conducted in Jordan, so North Jordan. This paper was published in 2017. It talks about the predictors and barriers to breastfeeding in Northern Jordan and could we do better? Next, please. So the abstract, the method of the study, it is a cross-sectional survey involving mothers with infants. Next, please. Next. And next, please. So the study design is a face-to-face cross-sectional structured questionnaire survey. It was conducted for outpatients in pediatric clinics at King Abdullah University Hospital, at Tertiary Academic Hospital of Jordan, University of Science and Technology in Irbid, and at Prince Rashid Military Hospital in the city of Irbid, the north of Jordan, during the period of 2016 to March 2017. Next, please. This study findings of a 500 female that pattern of breastfeeding in the first year of life, the exclusive breastfeeding is almost 51% of the at birth. At 1 month, this percentage reduced to 47%, at 6 months, 33%, and above 6 months, it's 9%. Next, please. This study also listed reasons for non-exclusive breastfeeding. So 53% of 500 women reported that the causes of non-exclusive breastfeeding is inadequate supply. 23% end of maternity leave, so they need to go back to their work. Baby illness or hospitalization took 14%. And when it comes to the other issues like maternal illness, latching difficulties, other maternal causes like breast issues, getting pregnant, and use of contraceptives, other infant causes, multiple gestation, so the mother would have more than one child, and then jaundice and poor weight gain. Next, please. So what's next? We will go next and see. So after this, we can summarize the research outcomes as identifying the main barriers to breastfeeding. So to start with, lack of knowledge about breastfeeding, misconception that formula is equivalent, breastfeeding is not social norm in many communities, poor family and social support, embarrassment about feeding in public, lactation problems, and finally, returning to work and accessing supportive childcare. Next, please. There's also another systematic review of a qualitative research on the barriers and facilitatives to breastfeeding practice in Sub-Saharan African countries. Next, please. This systematic reviews has several studies that have shown that different factors, including social status, level of education, maternal age, lack of parental support, living with a partner, employment status, priority, place of delivery, smoking during pregnancy, and the presence of baby-friendly hospital initiative policies are associated with exclusive breastfeeding in high-income countries. Next, please. And when it comes to developing countries or low-income countries, socio-demographic factors like maternal age, education, employment, residency, cultural and religious practices, in addition to arrangements, antenatal care practice, home delivery, and professional assistance at birth have been shown to be associated with suboptimal breastfeeding practice. Next, please. In this systematic review, they had 20 studies involving 836 participants from 11 countries were included in this systematic review. Next, please. So 15 studies employed a qualitative study design, 3 employed a mixed method approach, a study design, 1 involved a case study, and another adopted phenomenological approach. All of those studies used either in-depth interviews or focus group discussions. Next, please. So they divided the major themes and sub-themes of barriers to exclusive breastfeeding. So they had the mother-infant factors. They said two studies reported that mother formal employment and informal work schedule, perceived breast milk insufficiency, concern of the effect on mother's appearance, poor understanding or lack of awareness of exclusive breastfeeding benefits, being HIV positive or fear of transmitting HIV into the child, schooling or returning school or work, poor maternal nutrition, maternal perceived discomfort and embarrassment. They also refusal of the mother to breastfeed for several other reasons. Next, please. And when it comes to the infant factors, a crying baby may cause the mother to feel anxious and inability to breastfeed the baby, infant's difficulty in latching or positioning or refusal to breastfeed, and other issues like hospitalization. When it comes also to other factors in the systematic review, they reported that some breast conditions like cracked nipples or painful sore nipples, also breast milk lightness and loosey odor. Next, please. The other factors or barriers are the supportive or structure-related factors, the family influence, the healthcare system, and the workplace influence in supporting the mother. And finally, the influence of traditional and socio-cultural beliefs. Next, please. So in conclusion, what is needed for the mother and the healthcare team? It's all about education, multidisciplinary team support, environmental support, and workplace support. Each one of these populations play a major role in the mother supporting for exclusive breastfeeding. Next, please. I put out some recommendations of the American College of Obstetrician and Gynecologists, ACOG, that makes those recommendations support the initiation and continuation of breastfeeding. I'm gonna mention like two of those recommendations. The first one, the American College of Obstetricians and Gynecologists support individual informed decision making about breastfeeding free from commercial influence and bias. Parents have the right to make their own informed choice about whether or not to breastfeed. For those parents who desire to breastfeed, the obstetrician gynecologist should use a multidisciplinary approach that involves practitioners, community, lactation support, and family members, employers, and child care providers to help parents overcome obstacles and obtain the benefits of breastfeeding for themselves and their infants. Next, please. Next, please. So as a take-home message, we can say that the mother herself would help in only the breastfeeding process. The child also play a role and the society play a huge role. So as a researcher, I would say, like generally speaking, future studies must include or explore the potential of emerging technologies. We know that nowadays we are in a smart society and we need like something of technology coming through the healthcare system to support women to breastfeed exclusively for at least the recommended period of 6 months. We could have like for example, an educational application combined with the channels for practice support. We could look for immersive and tangible computing system that can provide real insights into breastfeeding, not just for the mother, but also for the partners. For example, it's like virtual reality of breastfeeding simulations. So it's not only, so as a take-home message, it's not the mother alone. We should encourage the family, the society, the overall environment to help out and to increase their knowledge about the importance of exclusive breastfeeding and for the mother and the child. And by this, I will end my presentation with a list of references. Thank you very much. And if you have any questions or want to contact me, I do have, next please, the contact details on the email provided. Thank you very much.
Thank you so much, Dr. Aya, for your interesting and informative presentation. So yeah, it may be beneficial to consider pathways toward logistical system development to provide digital solutions that not only can improve breastfeeding knowledge, but also are designed in a way that also allows them to affect other breastfeeding determinants. Thank you again, Dr. Aya. So our next panelist is Ms. Zainab Al-Bukhari. Zainab Al-Bukhari received her bachelor degree in nutrition and food science in 2002 and her master's degree in human nutrition and dietitian in 2018 from University of Jordan. She became an international board certified lactation consultant in 2021. She has worked with NGOs for more than 4 years in camps, providing counseling about infants and young child feeding, and has provided lactation counseling for mothers since 2018. She is a member of the administrative board in the Breastfeeding Support Association, and she is currently the in-service training program manager under the Community Health and Nutrition Project. Ms. Zainab Al-Bukhari will talk about challenges of breastfeeding practices in Jordan, real-life experiences. Welcome, Ms. Zainab. We are glad to have you here. The floor is yours.
Thank you, Muaz. Thank you, everyone. Hello, everyone. So today I'm going to talk about the challenges of breastfeeding practices in Jordan from real-life experiences. Next, please. I will start my presentation by talking about the breastfeeding situation in Jordan, and this is as a result of the demographic and health survey, which was conducted in 2018. Regarding breastfeeding, 92% of children are breastfed at some point in their life. In the DHS survey, they found that also 2 in 3 children were breastfed within 1 hour of birth, while 83 were breastfed within 1 day of birth. So contrary to the recommendations, 43% will receive a pre-lactate feed. Regarding the second practices, which is exclusive breastfeeding, from the DHS survey, they found that only 1 in 4 infants under age 6 months are exclusively breastfed, and the median duration of the exclusive breastfeeding is less than 1 month. So the practices regarding breastfeeding, for example, the exclusive breastfeeding is decreased as the infant is increased in his age, becoming older. Next, please. I will present today the results from the formative research that was conducted under the Community Health and Nutrition program, which was studying the key behaviors that the CHN project is aiming to achieve a measurable improvement in. The 6 maternal, infant, and young child nutrition, and the postpartum family planning behaviors. The first 3 behaviors are talking about specifically breastfeeding, which is the mothers initiate breastfeeding within 1 hour of delivery. Mothers breastfeed exclusively for 6 months after birth. And the third one is that caregivers feed adequate amounts of diverse, nutritious, age-appropriate complementary foods to children from 6 to 23 months while continue to breastfeed. Next, please. So the CHN formative research objectives that CHN conducted 3 complementary formative research activities exploring the project key behaviors: the insight gathering activity, the social norms exploration, and the third one is the trials of improved practices. And now we will see the key findings regarding main 3 practices regarding breastfeeding. Next, please. So the key findings regarding the early initiation of breastfeeding is that the knowledge of early initiation of breastfeeding and its importance varied across the target segment. The awareness about importance of colostrum was significant. The participants who successfully initiated breastfeeding post-delivery were a minority, and that the use of the pre-lactate feeds are common, reinforced by social norms. The perception of the ideal time for exclusive for early initiation of breastfeeding varied from first hour till after recovery. So, 8 focus group discussions were found that within the first hour of birth, they recommended the early initiation of breastfeeding, while another 9 focus group discussions were reported that the early initiation of breastfeeding should be between 1 to 3 hours after delivery. 8 focus groups reported that it should be after 3 hours, while 7 groups reported that after the recovery of the mother. Next, please. Now we are talking about the barriers for the practice of early initiation of breastfeeding. The first barrier is that regarding the health of mother and child. When mother's health and childbirth delivery method, whether the mother was fatigued from childbirth, or the vaginal delivery versus the cesarean section, this was the first barrier for the early initiation of breastfeeding. Also, the health of the baby, if the baby is admitted to the NICU or if he's suffering from jaundice. Another barrier, which is the delivery context and setting, public versus private hospital. Women's decision not to breastfeed at all. And the final barrier was the COVID-19 pandemic. Next, please. Thank you. Now, regarding the second practice, which is the exclusive breastfeeding, the key findings, which was raised from the formative research, that the general knowledge of exclusive breastfeeding is low. Most challenging period for exclusive breastfeeding was the first few days or week after delivery. And the exclusive breastfeeding is difficult and uncommon. Participants estimated that only around a third of mothers in their communities breastfeed exclusively. Regarding the barriers for the exclusive breastfeeding practices, the most mentioned barrier to exclusive breastfeeding was mother's employment. Also, the health concerns for the mother, whether she is suffering from anemia, low calcium levels, fatigue, she is on medications, or she has a new pregnancy. And for the child, that he is not gaining enough weight. Also, another barrier, which is supply and latch concerns. This is an important barrier, and it also was expressed by the fathers. Another barrier, which is the healthcare providers' recommendations on use of formula when baby doesn't gain enough weight, and the social norms encouraging women to introduce solid foods before 6 months. This is by old females in the family. Next, please. Regarding the third practice, which is the continued breastfeeding for up to 2 years, the key findings was that the average duration of intended breastfeeding is 18.6 months. In Karak, it was 20.2 months, while in Amman, it is lower, it is 17.7. And you notice that another finding that the experienced mothers will continue breastfeeding till the age of 20 months, while first-time mothers, it will decrease to 16.9. Another key finding that the continued breastfeeding for up to 2 years was perceived as uncommon and impossible goal. The participants expressed positive impact on continued breastfeeding on child, mother, family, from financial burden, and on society. And women most likely to breastfeed for 2 years was loyal, in good health, committed to religion as per the Quran preaching, or unemployed. While women who are less likely to breastfeeding for 2 years, spending lots of time outside the house, they were employed, anxious about appearance, wanting to get pregnant again soon, and women who have health challenges. Next, please. So the barrier from the formative research regarding the practice of continued breastfeeding, they found that for healthcare providers, they are the most common influencer on women's choice to breastfeed for up to 2 years. So the barriers was lack of supportive environment, for example, the woman's employment, social beliefs, breastfeeding for 2 years is considered too old, or breast milk loses its nutritional value over time, or that insufficient milk for the next child she bears. And the final barrier is that the challenge on mother, her health and ability to take care of herself and fulfill her responsibilities. Next, please. So what I presented till now is a result is the key findings and barriers for 3 practices raised from the formative research under the Community Health and Nutrition Project. Now I'm going to talk about the challenges of breastfeeding practices in Jordan as real life experience as an IBCHC. Usually, the cases who approaches IPCHC are after discharge and during the first week postpartum. This is after the milk is coming in. Mothers who start giving formula to their infant at hospital or during the first week postpartum. Mothers facing difficulties in positioning and attachment, suffering from pain during breastfeeding, or mothers having breast and nipple conditions. Mothers of infant who is admitted to the NICU or an infant with special needs, and mothers think her milk supply is not enough or actually her milk supply is not enough. Next, please. So the cases, or let's see the mother's profile, was that they are first-time mothers, educated, they are a holder of bachelor degree at least, believe in breastfeeding and have good knowledge and information about breastfeeding, and mothers from other nationality rather than Jordanian. Next, please. So many barriers for breastfeeding in the real community. The first one was the mother employment. In regard to the workplace, not supporting exclusive breastfeeding in terms of nursery availability, decent place for milk pumping or milk expression, providing mothers with 1 hour leave for breastfeeding, and the maternity leave duration, which is varied between the public sector and the private sector. The second barrier regarding healthcare providers. Sometimes healthcare providers not supporting breastfeeding practices or may promote the use of formula for some reasons, or may provide misconceptions about breastfeeding. Next, please. Another barrier, which is the health conditions for mother and infant and the separation. So lack of support from healthcare providers in case of health condition for mother or infant, or in the cases of separation between the mother and her infant. Lack of knowledge by healthcare providers to support mother who is suffering from specific health conditions to continue breastfeeding. Next, please. Another barriers like poor implementing of the PMS code, the intensive marketing for formula, even some healthcare providers, the unsuccessful previous breastfeeding experiences also was a barrier, lack of knowledge with the benefit of breastfeeding for both mother and child by mothers and families, no equity in knowledge, information received by mothers and families, different areas. They would receive maybe the breastfeeding messages through different channels, or they would receive different information and knowledge. And the last one was no decent places or areas supporting breastfeeding in public. So after the list of references, let's talk about the take-home messages that breastfeeding really, it is not a one mother only job. No, it should be supported by the society, the community, all healthcare providers, by the family, and also to encourage mother to continue breastfeeding and to practices all the related breastfeeding practices. This is from side. Thank you for your listening.
Okay, thank you so much, Zainab. Yeah, it's obvious that mothers need a lot of support at the level of healthcare providers, peers, family, and community to initiate and continue breastfeeding. Thank you again, Zainab. It was very rich and comprehensive presentation. So, and now, last but not least, let me welcome our panelist, Dr. Reem Al-Ajlouni. Reem Al-Ajlouni is a public health and policy professional with demonstrated experience in project design and management in the area of health systems, strengthening health governance, organizational development, and health financing. Dr. Al-Ajlouni has extensive work experience in the health development sector, working with international and national organizations. Currently, she is the director of the Jordan Breast Cancer Program, a national program led and supported by the King Hussein Center, Cancer Foundation and Center. Previously, she served as the health project management specialist at USA Jordan, also as a national health officer at UNICEF and a program coordinator at Médecins du Monde, France. Dr. Al-Ajlouni is a member of several forums and committees in the public health field and has a number of published articles. Dr. Al-Ajloni holds a bachelor degree in pharmacy from the University of Jordan and also a postgraduate diploma and master degree of health economics from University of South Wales. Dr. Al-Ajloni today will talk about breastfeeding for cancer prevention. Welcome, Dr. Reem. We are happy to have you in this webinar. The floor is yours.
Thank you very much, Dr. Muad, and thank you very much for the Jordan Nutrition Innovation Lab, for Tufts University, and for everyone attending with us today. It's really my pleasure to be with you today, and thank you for allowing me to share, to participate in this very important webinar. Next, please. I will talk about breastfeeding for cancer prevention. I'm the director of Jordan Breast Cancer Program, and always in all of our awareness-raising activities, including lectures, home visits, community activities, we always raise awareness about breastfeeding as one of the main factors that can lower a woman's risk of getting breast cancer. As mentioned by my previous colleagues, the very interesting and informative presentation by Dr. Aya and Ms. Zainab, breastfeeding has many benefits, as you know. It provides many health benefits for infants and babies, but also has many health benefits for the mothers. I wanted just to highlight this because this is from our observations. When we go to the community, less people, or let's say less women, understand that breastfeeding also is important for their health. They understand it's very important for the baby's health, but also it's important for their health. This is what we also always raise awareness about. Next, please. Breastfeeding can lower mothers' risk for some cancers and some other non-communicable diseases, including high blood pressure, type 2 diabetes, breast cancer, and ovarian cancer. As I mentioned, we always raise awareness, we always include breastfeeding as one of the factors that lower mothers' risk or women's risk for breast cancer, with many other cancer prevention factors, let's say, including all non-communicable diseases prevention practices, including smoking cessation, eating healthy, maintaining a healthy weight, practicing or performing the regular screening and checkups for breast cancer, and breastfeeding. Always we mention breastfeeding because it's really important. Next, please. Breastfeeding lowers the risk, but the most important element is the length. The more the duration of breastfeeding, the better the protection against breast cancer. So in an analysis for 47 studies done by the Lancet, they compared the mothers who breastfed compared to mothers who never breastfed. So a mother who breastfed for a lifetime, a total of 1 year, were slightly less likely to get breast cancer. Mothers who breast for a longer time, including 2 years and above, were about they got twice the benefit compared to those who breastfed for a total of 1 year. And mothers who breastfed for a lifetime total of more than 2 years, they got the most benefit. Although data is limited and research with this is controversial, breastfeeding for less than 1 year may also be linked to lowering the risk of breast cancer. Next, please. Okay, now when we say that it's one of the factors that lower your risk of getting breast and ovarian cancer, why is that? The main reason, as suggested by the research, is decreasing the lifetime of being exposed to hormones. So the main reason is a woman experiences hormonal changes that delay the return of her menstrual periods when she breastfeeds. This reduces her lifetime exposure to hormones such as estrogen, which are linked to increased risk of breast and ovarian cancers. Several studies showed that a woman's risk of breast cancer is related to the estrogen and progesterone levels. However, it's about being exposed to it for a long time and with high levels. So we always also mention to the woman women because they ask us family planning methods are safe and are like studies confirmed or studies showed that their link to breast cancer is minimal. Here I'm talking about long exposure to hormones and high levels. Also, the other suggested factors for lowering the breast cancer is making milk 24/7 limits breast cells' ability to misbehave. As you know, cancer is when cells start to grow without being controlled, uncontrollably. So having milk or producing milk, it's suggested that it decreases the cell's ability to misbehave. I mentioned the hormonal effect, and also very interesting factor is that women in general during pregnancy and breastfeeding, they tend to eat more nutritious food and follow healthier lifestyle, including limited smoking exposure. So this is one of the factors that may be linked. Next, please. Ms. Zainab mentioned about the barriers for breastfeeding. One of the main barriers for breastfeeding is a history of breast cancer. However, breastfeeding is possible after breast cancer. It's also linked, it was shown that women with breast cancer who breastfed have a 30% lower risk of recurrence, and they are 28% less likely to die from the disease compared to women with breast cancer who did not breastfeed before. However, reasons are not clear, or it's not really known why women who breastfed have less aggressive cancers. Breastfeeding is possible after getting breast cancer. However, it needs support at multi-level, and it needs expert advice. In a study, they showed that breast cancer patients or breast cancer survivors who were able to breastfeed after, they were supported from others. They got lactation counseling by a board-certified lactation consultant. They experienced frequent feeding, and they used galactagogues. However, the common barriers were medical counseling against breastfeeding, insufficient milk production, lack of support, refusal of the infant to breastfeed, and being tired from relying on one breast. So we always see that support is very important. Support by the health system or the healthcare provider, and support by the community. Regardless of the barriers with the counseling and professional counseling and support, it's always shown that breastfeeding is possible. Next, please. Okay. Here I want to mention that for any cancer prevention practices, smoking cessation, healthy diet, maintaining a healthy weight, breastfeeding, these are factors that lower the risk of cancer, but they don't eliminate the risk of cancer. And this is something I really needed to highlight, because we face a lot of myths about this when dealing with women in the community. They think that if they breastfeed, so they will never get breast cancer. Or we see cases where ladies, they ignore signs and symptoms, very clear signs and symptoms of breast cancer, just because they breastfed. Having said that, breast cancer is important, and it's one of the main public health interventions that we all should support and women should practice. However, it's just important for mothers to be aware and to be well informed about their health, not to neglect, not to ignore any sign and symptom for breast cancer, because it decreases the risk. However, it does not eliminate the risk. And there are a lot of studies and systematic reviews to measure this. It's very clear that breast cancer lowers the risk. However, it's controversial, as it's not always the case. When cancer happens, it happens, because cancer causes are still not well understood by the science. Next, please. Okay. I added this because this is from our observation. This is, let's say, our approach is to be holistic. What can we do to increase breastfeeding rates? Well, and in general, this question, what can we do to promote health in general? The simple answer is to be holistic. We need to support the mothers and the women themselves. We need to fix or mitigate the challenges related to the social and health system or health system around her. So to promote best practices in healthcare setting, support mothers at work and in communities. And it's very important, and this is something I put from my observations, it's not something I extracted from research, is to work holistically to women's health is indivisible. And when we talk about women's health, we really need to have more integrated approaches. We tend to work in silos. We tend, like, if there is a program about breast cancer, so we only talk about breast cancer. If there is a program about nutrition, so we only talk about nutrition practices. If it is about family planning, then our sole focus is family planning. But really what we found from our experience here at the Jordan Breast Cancer Program, the integrated approach is very important. You avoid many missed opportunities of reaching to women and to mothers with evidence-based knowledge, and women in general and communities in general are very hungry for good knowledge and for awareness and to adopt healthy practices. This is, in a brief, this is my presentation. Thank you very much. My take-home message is two things. Again, the holistic approach towards women's health. We miss many opportunities because we work in silos and we tend to focus on one thing. However, all of our health is linked to each other. The second thing is breastfeeding is very important. It's a great public health intervention that we all need to support. It lowers the risk of breast cancer. However, just to keep in mind that it does not eliminate the risk of breast cancer. So practice your screening and regular checkups. Be aware to the signs and symptoms by your body. Don't ignore them because God forbids, things can happen at any age, at any time. And I just want to mention, October is approaching. It's on Saturday. We have a national and a regional breast cancer awareness campaign. So I would like to encourage all of you, for the women who are attending with us, to practice the early detection practices and to support the messages of the campaign. Thank you very much.
Thank you so much, Dr. Reem. It was very nice presentation and sure it's a thought-provoking. So yeah, breast cancer lowers the risk of some cancers, but let's keep in mind that lowering the risk doesn't mean eliminating the risk. So being aware of the breast cancer symptoms is important, and also maintaining a healthy lifestyle and practices, including breastfeeding, is important for a woman. Thank you again, Dr. Reem. So thank you all. Now let's move to the Q&A section. Let's start with Dr. Aya. We have a question about the prevalence of exclusive breastfeeding in Jordan and to compare it with the regional prevalence. Can you tell us a comparison?
Sure.
Yeah, thank you.
So when it comes to Jordan, it is a bit low when it comes to exclusive breastfeeding. So while even more than 9 out of 10 children were breastfed at some point in their young lives, only 26% is the prevalence of exclusive breastfeeding in Jordan. And this is a recent study in 2019. But when we compare it with the region is about 34% of exclusive breastfeeding. So it's a bit low than the region prevalence. So 26 compared to 34%, it's a bit low. So The prevalence in Jordan is 26, and the region is 34%.
Okay.
Yeah.
Thank you, Dr. Aya. I have another question for you.
Yeah, sure.
You have mentioned some solutions to maximize the exclusive breastfeeding. Could you please elaborate more, talk about the most effective solutions?
Okay. So the solutions would be a holistic system development. So it's either putting the digital solutions to improve not only the breastfeeding knowledge, but also in a way that allows the woman and the community to assign the breastfeeding determinants. So it's all about like the triangle, the mother, the infant, and the society. There's also a point where the most effective approach nowadays is including technology, as I mentioned earlier. So it's really important because we're like developing every single year, and we have like technologies emerging in our health care system, educating the healthcare team, educating the parents, and increasing the knowledge of the mothers. All of that would lead to the most effective approach of like enhancing the exclusive breastfeeding prevalence among Jordanian women. And not to mention, also to mention, not to forget the workplace. Most of the mothers would have maybe some obstacles regarding the maternity leave. And when it ends, what happens is the mother wouldn't have either enough time for the breastfeeding, or they would feel like embarrassed. So encouraging also the workplace, increase their knowledge of the importance of breastfeeding would also play a huge role in increasing the effectiveness or the prevalence of exclusive breastfeeding.
Okay, thank you so much. So our next question is for Ms. Zainab. You have spoken about the lack of knowledge regarding breastfeeding, that the knowledge is low. Could you tell us from your point of view, what's the reasons why we have this lack of knowledge?
Okay, the lack of knowledge we have on two aspects: lack of knowledge between families and mothers, and lack of knowledge between the healthcare providers. So let's talk about the lack of knowledge between healthcare providers. Healthcare providers during their journey of studying, whether bachelor degree or diploma or whatever, whether they are like, for example, nurses, midwives, or doctors, they didn't exposure to a good resources talking about breastfeeding. They will maybe study a course about breastfeeding, which is very minimal in the minimal aspects. So once we start giving them train them on the recommended breastfeeding practices, and what is breastfeeding, what is the benefits, how to support mothers in breastfeeding who suffered from any issues with breastfeeding, this would be, I think, the base for increasing the prevalence of the practices regarding the breastfeeding, and also to increase the knowledge between the community and the society. Because usually, always, mother is reaching the healthcare providers who is trusted for her doctor or the midwife or the nurse, to give her a message about breastfeeding, about also the her child nutrition. So when the healthcare providers is trained on these messages, on child nutrition, mother nutrition, and also on breastfeeding, so healthcare providers can support mothers, can advise mothers, and also by this we can build the knowledge in the society. In addition to that, we should have not only increase the knowledge of the healthcare providers, to have more promotion for breastfeeding at the community level, more promotion about the recommended practices for breastfeeding. For example, the early initiation of breastfeeding, the exclusive breastfeeding, which is till the end of the 6 months of age for the child, to continue breastfeeding till the age of 24 months. Those, with the promotion, once we promoted those practices in the community, then by this we will increase the prevalence of the exclusive breastfeeding, the prevalence of early initiation, and also we will enhance the behaviors that is related to the child nutrition and also to the mother nutrition.
Okay, thank you so much. So I will take advantage that you are a international board certified lactating consultant, and I would like to ask you at what periods or time the mothers approach you as a IBCLC?
Usually when the mother discharged to home after delivery, and within the first week after delivery, because once the mother, her milk is coming in, if she has no knowledge, no information about how to deal with this, with the milk coming in, or how to deal with breastfeeding for her child, so she will start suffering from some issues and she needs support. So this is the most important period of time, which is of course it's very important to have early initiation at hospital, but also to continue the support after the mother is discharged, and to help the mother, or to give her a discharge plan that once you face this issue, please contact this person or this counselor.
Okay, and just briefly, how the mothers receive the support?
Very well, because the mother is seeking this support. The mother is looking for example, an IBCLC to support her in some issue which is related to breastfeeding. So once she is aware of her problem, or aware that she has an issue regarding breastfeeding, so once she approaches the IBCLC or the healthcare providers who will support her, she becomes very satisfied. And also she will, for example, buy the book for each advices by the expertise in regarding to breastfeeding.
Okay, thank you so much. I will now ask Dr. Reem Al-Ajloni. So Dr. Reem, do you think that this is the time to do more studies in Jordan related to breastfeeding for women with the breast cancer?
Yes, it's always the time actually to do more studies and research to improve the health research in general and scientific research in Jordan, and to in general to support all the initiatives and to support the academics who does research in general related to breastfeeding or not. We lack a lot of evidence related to when it comes to breast cancer. We lack a lot of evidence about breast cancer in the Arab world in general, not only in Jordan. Jordan may be one of the countries of the Arab countries that at least we have a national cancer registry, we have an early detection registry, we have some universities who are interested in research related to cancer. But when it comes in general, compared to the high income countries and particularly compared to the US, we lack a lot of evidence related to breast cancer, including the link to breastfeeding. So yes, it's the time, and it's always the time to do more research and to support research and studies. Is that enough, or did I understand well your question?
Perfectly.
Okay.
Perfectly. Yeah. So, Dr. Reem, since in Jordan we have more than 20% of the cancers is breast cancer, what do you think what we can do to prevent breast cancer in general?
Okay, great question. Actually, for breast cancer, the best prevention is early detection. Breast cancer is the most common cancer in Jordan. It's around 21% of all cancers among. Sorry, I just realized that my video is off. It's 21% of all cancers among the two genders, and it's 39% of female cancers. Can you hear me? I have some technical problems.
Yeah, we can hear you.
Okay, great. Yes, it's 39% of the female cancers in Jordan. So what we can do to control breast cancer is early detection. Early detection is the cornerstone for improved health outcomes, for the improved morbidity related to breast cancer, and to decrease mortality. For other prevention, it's like all other non-communicable diseases prevention. Quit smoking, healthy diet, physical activity, no alcohol consumption, and always your regular checkups, or for sure breastfeeding.
Okay, thank you. So because you are talking about breastfeeding, so, and as a director of the cancer program in Jordan, do you include breastfeeding in your activities?
Yes, actually, yes. As I mentioned, our approach, we follow a social behavior change communication approach, and this is an integrated holistic approach. So we reach to the women in their places, in the communities. We raise their awareness. We educate them in different using different approaches and different methods, and we talk about her health in general, focusing about breast cancer. So when we talk about her health in general, yes, we talk about breastfeeding, we talk about cancer prevention or non-communicable diseases prevention, we talk about family planning and correcting all the myths related to breastfeeding and family planning related to breast cancer. So our approach is integrated, focusing for sure on breast cancer. When we do referrals to health services, it's only related to breast cancer. But when we do awareness, it's always related to the woman's health in general.
Okay, thank you so much, Dr. Reem. Dr. Aya, you have your hand raised. If you want to talk, please.
Yes. Okay. I do have two comments regarding two comments over the chat. One from Dr. Malak Jaber. She mentioned that breastfeeding can be supported by providing specific places in malls and in public areas to allow the mother for breastfeeding. The thing with that is this is why we focused a lot on the knowledge and the practices of and the benefits of exclusive breastfeeding. The breastfeeding itself is an embarrassing process when it is made in public. This is the most concern for the mothers. Hopefully, we would have specific places for the mother, but this will need a huge amount of education for the stakeholders, for the business owners, for also the workplace to take it into account. And when it comes to Dr. Suhaila Halasay, she mentioned that breastfeeding is not only the mother responsibility, and it's not an easy task to be done. The mothers need to be supported by their husband, and she asked if there is what have been done to encourage husbands to be involved in breastfeeding. So my answer would be, so far in Jordan, it's only like small focus groups and to encourage the husband to support the mother. Hopefully also we can reach out for the husband, especially for the first-time moms, because it's really important to have this family support, because the husband plays a major role in the mother's life. We could improve this by increasing the knowledge of the father or of the husband of exclusive breastfeeding, not only health-wise, but also financially or economy-wise. We would love to have such research or approach to be done. Looking forward for such a thing, and also such questions will open our minds towards the upcoming research. So thank you for your comments, Dr. Malak and Dr. Halasa, for your contribution and comments. And we would really look forward to do such research that will imply and ease the process of exclusive breastfeeding. Thank you very much.
Thank you very much, Dr. Aya. Very informative contribution. And I have a question for Ms. Zainab. In your presentation, mentioned that the early initiation of breastfeeding was more relevant among women who had normal vaginal delivery. Could you clarify that or elaborate why?
Okay, this is because nowadays the C-sections, the cesarean sections delivery method, it is under sometimes under general anesthesia, and once it is under general anesthesia, so some doctors, some healthcare providers asking mothers that no, you cannot early initiate breastfeeding because you are under anesthesia, and so this will be difficult for you. But once the mother is delivered through normal vaginal delivery, so she can practice the skin to skin and to practice the early initiation of breastfeeding. So this is the difference between the method. The method of delivery will affect the prevalence of the early initiation of breastfeeding between mothers.
Okay, thank you so much. And I will ask Dr. Aya, in this society, in the community, how we can raise the knowledge and do activities to promote the breastfeeding in general, because all of you are expert in this field. So I would like to hear your point of view, your ideas regarding that, how we can promote it in the community level. Dr. Aya, if you would start.
Yes, sure. So I would say it's never too late. We do have a nice approach, and even research confirmed that it's a collaborative effort. So it's not only the mother, as I mentioned earlier. The most effective approach to increase exclusive breastfeeding, according to science and scientific-based evidence, it's all about increasing the education of the healthcare provider about the importance of breastfeeding. There are many studies that confirm the benefits of the mother's exclusive breastfeeding, while the healthcare provider are also well educated about that role of breastfeeding. The other thing is the community or the society. Sometimes we would be misguided by maybe the response of the community. All of the community would welcome such initiatives to increase breastfeeding. So I would advise, as a researcher, to focus more on the understudied population. So when it comes to the fathers, the mothers, the grandmothers, and the mother-in-laws, so they are like a part of the community. So it's really advised to include those population to increase their knowledge and their part in to help the mother to breastfeed her baby exclusively for the first 6 months. So it is about, let's say, community, family, mother, healthcare provider, increasing the knowledge, emerging technologies, Also,
Yeah.
sometimes when you have technology, you could ease the process of, let's say, explanation of the latching process. When you have an audio visual video, so include the technology within any intervention that will enhance or improve the knowledge of the society regarding the exclusive breastfeeding.
Yeah.
So
Okay, thank you. I would also add policies, because
Yes,
this is
definitely.
a very
Yes.
very important part if you want to implement your messages. You need the help of the policies, because it eases a lot to deliver your messages and practices.
Yeah,
Thank
sure.
you. And before moving to Ms. Zainab, for the same question, I would continue with asking you, Dr. Aya, we had a
Yes.
question about regarding the perceived image of breastfeeding in public. Do you think it's important to work on social norms besides enabling the environment and establishing private places in public spaces?
Yes, it's really important to work on such aspect. The thing is, I've studied in the UK, and I've seen mothers over the bus stops, and even on the bus itself, traveling using the train. They use the breastfeeding as they don't feel embarrassed, but maybe because of the tradition and the norms, social norms of breastfeeding here and in Jordan. This may be like a tricky thing to be done, but if it is a policymaker or something that we increase the awareness of, that could be less embarrassing for the mother. And also, I would say encouraging policymakers to, we do have a maternity leave of 70 days. It is paid for the mother. I would also advise, I have seen this in Jordan, like in the private sectors, they would have a special room for the mother to pump her milk during like the 1 hour of lactation. So it is going slow, steady, but it is promising technique to be done even by policymakers and stakeholders by such an encouragement for the mother. As far as I know, there would be also some exciting research coming up with Dr. Suhaila Halaseh. She said that she is conducting a research about breastfeeding and expectant father. I'm really happy to hear that, because what we all are looking for is how can we ease the process of breastfeeding? So having the support of the father, the mother, the mother-in-law, the community, the policy maker, and the stakeholders would play a role in the social norms and in increasing the knowledge of the population. Let me just mention one thing that we have done. I used to be a counselor for the infant and young child feeding program at Zatri camp. We did distribute like a scarf, breastfeeding scarf, for the mother to breastfeed while she's in, let's say, in a public place. But the mother were like unable sometimes to wrap themselves with this scarf. So it's about increasing her knowledge about how to use such scarf to breastfeed her baby. But as I really want to say, we need to change, even if it's slight change, but we need to change that aspect, or the how people adhere to breastfeeding. Because when you increase the adherence of breastfeeding and its benefits, either on the community or the economy or even the policymakers, it's really important just to grasp the such norms to increase the exclusive breastfeeding. And thank you.
Okay, thank you. Ms. Zainab, can you tell us your thoughts how we can promote breastfeeding, raise the knowledge and the practices briefly on the society, how we can do that from your experience and point of view?
Yes, sure. First of all, as Dr. Aya mentioned, that it is the policymaker. So we need to have policies that is supporting breastfeeding in the whole community and in the whole society. We need to have a trained healthcare providers everywhere, whether in the under public or private sectors who are supporting breastfeeding. We need also to change the mindset of the community regarding the breastfeeding. As Dr. Aya mentioned that, sorry. In Europe, for example, or in UK or in Germany, the mother who is fed her child with a bottle feeding, all mothers are looking for her that this is a strange tradition or a strange way to feed her baby. Why? Because this is because the whole community and the whole society are supporting breastfeeding, and because there is many places in whether in public or whether in gardens or in malls, there are specific rooms for breastfeeding, so that mothers can go and breastfeed her child whenever he needs. In Jordan, we need to establish for this practices, we need to change the perspective of the community and also the society. We need to support not only the mother, we need to support also the family. And the mother needs support from her husband, from her mother-in-law, from her family. She needs support at the family level. And also, once she is going, for example, for a medical checkup, she needs to breastfeed her child, her infant. So at this facility, there should be a specific place for breastfeeding in regarding to the woman employment, to make sure that maternity leave, all mothers can take the maternity leave, the whole period of the maternity leave, whether they are in private or public sector or public sectors. The mother has her right to take 1 hour for breastfeeding, 1 hour leave till her baby is aged 1 year. And also, we noticed that not all workplaces are implementing that they have a nursery to support the breastfeeding and to support also mothers and to support the care of the children. So once we are working on many levels, on the family levels, on the healthcare providers levels, also on the community levels, this will affect the breastfeeding practices in Jordan, and also this will encourage breastfeeding as whole.
Okay. Great, thank you so much for your contribution. So it's nice if we could have more time to talk more and have all your questions to be resolved. But anyway, you can contact us for your questions, and the panelists will respond. So I will conclude that looking to the data we have in Jordan, it's clear that breastfeeding in Jordan is facing challenges. So many factors like social, economic, psychological contributes in that. And we need to work collaboratively to enhance the knowledge and raise the knowledge on breastfeeding, and facilitate the women to practice the breastfeeding, whether by the help of the policymakers that could allow them to practice this, the breastfeeding, maybe including the maternal leave days, places in the public areas. And more research is needed to further to investigate the actual reasons and what we can do to enhance the breastfeeding in Jordan. I would like to thank you all, thank all of you. I just want to give the floor now to Dr. Shibani to close this webinar. Thank you very much.
Thank you, Dr. Muad. And thank you all for joining us today for a very important webinar. Presentations made by our three panelists have really highlighted the benefits of breastfeeding, but also the challenges in optimal breastfeeding practices. And while breastfeeding has been traditionally considered as beneficial for the infant, there is more evidence emerging of the health benefits of breastfeeding for the mother herself. What I'm really taking away from this webinar and this discussion is that actions and interventions targeting this important issue requires individual, community, institutional, and policy actions. Awareness generation, whether of early initiation or of exclusive breastfeeding, is critical as a support to the mother at an individual level. And the latter particularly requires trained professionals. In addition, motivating healthcare providers and training them on breastfeeding promotion is quite necessary. At the institutional and policy level, women in the workforce really have significant barriers, and workforce policies or institutional actions that provide private spaces, enforcement of the BMS code, and health policies overall that provide a conducive and enabling environment for breastfeeding are clearly needed. My personal view is that we really do need to do more on highlighting the benefits of breastfeeding to the mother herself, whether with respect to postpartum weight loss and or subsequent lowering of the risk of NCDs and risk reduction of cancers such as that of the breast or the ovaries. While breastfeeding obviously does not completely lower the risk of cancer, what Dr. Reem has highlighted is that there are clearly links of supporting breastfeeding. Ultimately, empowering women in Jordan to demand support for breastfeeding is really critical. That is what I'm taking away. With that, I would really like to thank our esteemed panelists for presenting such a riveting and relevant set of presentations. And thank you all for joining and engaging in a vibrant discussion. The Jordan Nutrition Innovation Lab will continue bringing such webinars to you. So do please watch out for our notices in your email as well as our social media pages. Until then, have a good day, everyone. And thank you, Dr. Reem, Ms. Zainab, and Dr. Aya very much for such a fabulous webinar. Thank you all.
Thank you.
Thank you all. Thank you.
Thank you.